we are going to do an x-ray because Mason has been experiencing some distressing gastrointestinal problems. Mason, it's time for your x-ray. Okay, here's the x-ray machine. Let's see what happens. Right, what do we see here? All right, it looks like your liver and your stomach and your small intestine and your large intestine. And there's your gallbladder, that little green guy in there. And oh, what's that little thing in there? You know what, Mason? I think you have a gallbladder stone. We're going to have to operate. Okay, so we have cut open Mason's entire stomach and just ripped the skin away. Here's his gallbladder, right in there. It's a pear-shaped organ that connects to the liver and stores the bile from the liver. And if you can see this, there's his gallstone. So I'm going to move the liver out of the way and the stomach.
Hey.
And pull his intestines down a bit so we can focus on this cute little gallbladder. Here it is, and there's his gallstone. If you have one gallstone, it can be no big deal. Just left alone. If you're not having any symptoms, they won't remove it, they won't bother it, they'll just leave it there because it's not doing anything. Sometimes you can have more than one though, like a whole bunch. To be more specific, I have added the ducts here that connect the liver and the gallbladder to the small intestine for visual representation, and to introduce the third type of gallstone, which is called a traveling gallstone. And this is the type that I had. So traveling gallstones are gallstones that don't adhere to anything and they move with the fluid in the body. These are extremely dangerous because they can make their way down into the ducts and get stuck and cause infection and ruptures. They can be life-threatening, and this often leads to having to have the gallbladder removed or some type of surgical intervention. This is why I had my gallbladder removed, because I had a traveling gallstone. So the gallbladder is attached to a cystic duct, which leads to the common bile duct here. And the liver has the right and left hepatic ducts that also connect to the common bile duct here. And when the liver shoots out bile, it goes down these ducts and goes into the small intestine to help digestion. And then the extra goes to the gallbladder for storage. And then when needed, the gallbladder will shoot bile down through the cystic duct and to the common bile duct and down into the small intestine. And when surgery happens and the gallbladder is removed, they remove the gallbladder and they also remove the cystic duct as well. So then what you're left with is just the left and right hepatic ducts straight from the liver that deliver the bile straight to the small intestine. So, who's at risk of developing gallstones? Well, no one's immune, but most commonly anyone who's female is most at risk, over 40, obese, has a high-fat diet, takes estrogen, is diabetic, or has any other intestinal disease or liver dysfunction. How can massage help? Once the incisions have healed, 2 to 6 weeks depending on the surgery type. If you're wide open, it's going to take longer. Massage can help with scarring, fascial restrictions, constipation, and diaphragm discomfort. Using techniques like cross-fiber scar work to work those scars out, gentle petrissage to the abdominal muscles, and fascial work for restrictions in the fascial area, and specific kneading and compressions to the diaphragm area can be really helpful. Things get stuck up. Pay special attention to the client positioning because prone may be uncomfortable, any signs of pain, and scar sensitivity.